Good day everyone, praise be Jesus and Mary. I am Sheila May Mihurada, and together with my group mates, James Sandy Galamiton and Christian Cacho, we are going to report the chapter 25, the microbial diseases of the digestive system. And the topic that I will discuss are the function of the digestive system, the normal microbiota of the digestive system, the bacterial population of the gastrointestinal tract, and the bacterial diseases of the mouth. And the rest of the topic will be discussed by Christian and James Sandy. First, the digestive system. Digestion is important for breaking down food into nutrients which the body uses for energy, growth, and cell repair. Digestion works by moving food through the gastrointestinal tract. As you can see in the picture, the main organs that make up the digestive system are the mouth, esophagus, stomach, small intestine, large intestine, rectum, and anus. Next is the normal microbiota of the digestive system. The gastrointestinal tract. The main function of the gastrointestinal tract are to digest and absorb ingested nutrients and to excrete waste product of digestion. And these organs include mouth, pharynx, esophagus, stomach, small intestine, and large intestine. And the accessory structures are the teeth, tongue, salivary gland, liver, gallbladder, and pancreas. Next is the bacterial population of gastrointestinal tract. The mouth has large microbial population, and the stomach relatively small due to a high acid content. And the small intestine has a small population, while the large intestine has very large and 100 billion bacteria per gram of feces. Then the bacterial diseases of the mouth. The dental caries, also known as cavities, are holes in your teeth that form from tooth decay, and cavities are one of the most common oral infections. The Streptococcus mutans is one of the more important cariogenic bacteria. Next is the periodontal disease. It is a result of infection and inflammation of the gums and bone that surround and support the teeth. In its early stage, is called the gingivitis. Can become swollen and red, and they may bleed. Next is the acute necrotizing ulcerative gingivitis. It is a painful infection of the gums. If normal bacteria in the mouth overgrow and the gums can become infected, the gums hurt, and people sometimes have extremely bad breath. Occurs most frequently in smokers and debilitated patients who are under stress. Next is the protozoan diseases of the digestive system. The protozoan diseases of the digestive system are giardiasis, cryptosporidiosis, cyclospora diarrhea infection, and amoebic dysentery. The giardiasis is a diarrheal disease caused by a microscopic parasite, Giardia duodenalis. So, the giardiasis, it can cause diarrhea, stomach cramps, gas, and nausea. Once a person or animal has been infected with Giardia, The parasite lives in the intestine and is passed in stool or in your poop. Once outside in the body, Giardia can sometimes survive for weeks or even months. Next is the cryptosporidiosis, an illness caused by tiny one-celled Cryptosporidium parasite. So when the Cryptosporidium enter your body, they travel to your small intestine and then burrow into the walls. Most common symptoms of the cryptosporidiosis are watery diarrhea, stomach cramps or pain, dehydration, vomiting, and fever. Next is the Cyclospora diarrhea infection. It is a parasitic infection in the intestine that can cause symptoms such as watery diarrhea, nausea, and stomach cramps. So, it is caused by consuming food or water that is contaminated with the parasite Cyclospora cayetanensis. Next is the amoebic dysentery, an intestinal infection caused by protozoan parasite called Entamoeba histolytica. The person get it by putting anything in their mouth that has touched or infected feces, or by eating and drinking food or water contaminated with the parasite. And then lastly is the helminthic diseases of the digestive system. The helminthic diseases of the digestive system are the tapeworms, Hydatid disease, pinworm, hookworms, ascariasis, and then trichinellosis. First, the tapeworms. What causes the tapeworms? Infection is caused by ingesting food or water contaminated with tapeworm eggs or larvae. So if you ingest certain tapeworm eggs, they can migrate outside your intestine from larval cysts in the body tissues and organs. How do you get rid of tapeworm naturally? There are herbs that had antiparasitic effects in some animals. These include the garlic, pumpkin, and ginger. But more research is needed to confirm the benefits in humans. And the next is Hydatid disease. Is a potential serious, sometimes fatal, condition caused by cyst containing. So they are most commonly found in the liver and lungs, although they may also occur in other organs like bones and muscles. Next is pinworms, an intestinal infection caused by tiny parasitic worms. The pinworms, you can become infected usually unknowingly by swallowing infective pinworm eggs that are on finger, under your fingernails, or on clothing and bedding, and other contaminated objects and surfaces. Next is the hookworms. Hookworms are the intestinal blood-feeding parasitic roundworms that caused by types of infection known as helminthiasis. So, itching and localized rash are often the first sign of infection. A person with heavy infection may experience abdominal pain, diarrhea, lost appetite, weight loss, fatigue, and anemia. So next is ascariasis. Ascariasis is a type of roundworm infection, and it is caused by ingesting those worm eggs. The ascariasis can happen when hands or your finger that have contaminated dirt on them are put in the mouth, or by eating vegetables or fruit that have not been carefully peeled, washed, and cooked. Next is the trichinosis. The trichinosis is a disease that people can get by eating raw or undercooked meat from animals infected with the microscopic parasite Trichinella. So the signs and symptoms, severity and duration of the trichinosis vary: nausea, diarrhea, vomiting, fatigue, fever, and abdominal discomfort are often the first symptoms of trichinosis. So, if the infection is heavy, patients may experience difficulty coordinating movements and have heart and breathing problems.